Hey guys, it's Megan Cruson. I wanted to talk today about neck pain. It's one of the most common things people come to see me for, and how I treat neck pain and my approach to it. So to do so, I'm going to actually ask my cameraman Mike to come step into the picture and have a seat on the table, just so I can show you guys what I'm talking about. So our neck is really a central area between our head, which houses our brain, and our thorax, which houses our heart. So both of these are very important, our brain being for our nervous system and our heart being for our circulatory system. So with cranial sacral therapy is generally how I treat this. I want to make sure there's proper blood flow coming out of the head to the neck and down to the heart and to the rest of the body. As well as we want to make sure no nerves are being pinched along the way. So proper alignment of the neck is very important, so making sure the vertebrae are mobile, as well as making sure the cranial bones are moving properly. We have our whole spine moving properly as well. And that kind of brings me to my second point. So I really want to make sure that posture is an important thing with a patient while they're at work, while they're at home. So really making sure we're sitting up nice and straight, and I'm going to go through that in another video just to show Mike how he can improve his posture. But today we're just going to touch on posture and how that affects our neck. So really we don't want to have this neck extension that we kind of see in Mike. We want him to tuck his chin and really straighten his neck. So that's really important. So the third thing I want to talk about is breathing. So breathing is super important because when we breathe in properly, we're actually using a lot of muscles that are straining our neck. So a lot of people, when they take a big breath in, can you take a big breath in for me, Mike? So he's using muscles from his chest. So now you can breathe out. So really what he's doing, he's actually overusing the accessory muscles he has in his neck and not as much using his diaphragm to breathe. So we really want to make sure we're using our diaphragm to breathe. So when we breathe in, we want to fill our stomach. Yep. Whereas you're filling your chest. Okay. So fill your, there we go. And when we relax, we want to let our stomach fall. Instead of using all these muscles at the top here that are really straining our neck and really cause us to kind of pull forward into that slouch posture that we don't want. So those three things are kind of how I treat patients. I definitely treat cranial sacrally, make sure they're educated about their posture and their breathing.